Obesity is the world's largest public health crisis, and it is on the rise. But increasingly, new treatments are hitting the market every day, which is great news. Another positive here is there is an investment opportunity within this particular story. We're going to break it all down for you right now on UBS Trending. Hi, everyone, and welcome to UBS Trending. I'm Anthony Pastore. I'm here with my CIO colleagues, Nadia Lovell and Eric Potiker. Good to have you both here in the studio. This is a topic that has become so hot. We're talking about these new weight loss treatments that have derived from diabetes treatments. We all know what we're talking about, the Ozempics and the Wegovy's. But Nadia, diabetes and obesity are, as I said in the intro, some of the world's largest health crises. Maybe put that into context for us from your perspective. How prevalent are these conditions, and what's the size and growth of the market and even the economic impact from that?
Yes, Anthony, as you mentioned, they're quite large and prevalent, and it continues to grow. I mean, in fact, what you're seeing is that the number of people living with diabetes, adults living with diabetes, is over 500 million globally. And that includes there's over 30 million here in the United States. And so that's about 10% or so of the world's population. And if you look at some of the estimates out there, that's projected to grow over 20% by the end of this decade. And when you think about it from an obesity standpoint, those numbers are even more staggering. In fact, you see the World Obesity Atlas is projecting that by the end of this decade, that there will be over 1.2 billion adults living with obesity. So that's a 50% increase from today. And when you think about it in terms of within the U.S. tops the chart in terms of the country with the most obese adults. So about 1 in 3 Americans are considered obese today. And that number is expected to increase to 1 in 2 Americans by the time we get to 2030. The economic burden is also quite large. In fact, people with diabetes tend to incur over 2 times more medical costs than those without. And then when you think about it in terms of here in the U.S., that means over $250 billion is spent each year on diabetes. And for obesity, that's even greater. In fact, what you see in the U.S., nearly $400 billion is spent on the treatment of complications due to obesity and comorbidities.
The numbers are staggering. I'm glad you gave us those charts to look at, because when you see it in visual form, it really does paint a really solid picture. I even saw a statistic that said 19 states in the U.S. have a number of 35% or more obese folks living in those states. It was 16 in 2022. So you can, as you just indicated, Nadia, the growth just continues in obesity cases. So Eric, as Nadia is talking about here, there's this very high unmet need for people who suffer from obesity for various reasons. But my understanding, and of course we talk about this consistently, we've got treatments out there. There are these GLP-1s, there's all these celebrities and influencers who are pushing this on social media, but there seems to be a real case for folks who have or suffer from obesity. What's happening? What's going on in the market right now?
As you mentioned, there's a lot of attention in the media. You mentioned the drugs that are being used initially for diabetes. This class, the GLP-1 class, has been around really for over a decade. And what's really changed in the last couple of years has been the availability of long-acting, once-weekly injections. And you mentioned Ozempic, Wegovy. Wegovy is actually the only one approved for weight loss. We expect there'll be another one approved for weight loss by early next year. And it's those higher dose versions that really achieved really strong results in clinical trials and that we're seeing in the real world in terms of weight loss, but also as very strong diabetes therapies before that. I personally, and I think probably many in the audience too, know family members, individuals, friends who have seen significant weight loss benefits from these drugs. So the emergence of a really efficacious and reasonably safe weight loss drug is really what's new in this case, even though these drugs have been around for a while.
Yeah. It's interesting when you think about it from the perspective of starting with diabetes. If people are taking it for diabetes, but the side effect is that they're going to lose weight on it. I mean, it was initially a side effect. doesn't that also then, by some way, make it a zero-sum game where if you start giving it to people first for weight loss, they may not get diabetes at all?
So that's an eventual question for what does the world look like in 20 years.
Right.
And we actually think that both diabetes and obesity are really attractive long-term investment opportunities that are complementary. On the diabetes side, we've seen innovation really over the last 5 to 7 years with continuous glucose monitoring or CGM patches and automated insulin delivery pumps that are helping diabetic patients keep their blood glucose levels at acceptable targets, which helps avoid the complications of diabetes. It doesn't cure diabetes, but it does remove a lot of the downstream health impact and cost that Nadia just mentioned. And we view very much the diabetes market and the obesity market as complementary because there's quite an overlap among those patient populations and because the availability of new effective treatments is resonating with patients, with family members, and with caregivers. So these individuals are now showing up to the doctor, getting diagnosed. There are now treatment options that are far more effective, and many of these patients are being treated with the GLP-1 drug and with the CGM and with an insulin pump. So we view that emergence of really strong treatments as driving growth into what is still, as Nadia mentioned, very under-penetrated markets. And that penetration is going to continue to increase, we think, over the next decade. Now, to your question about whether it's a zero-sum game, that I think is really a question where there are too many unknown variables in terms of what will happen with GLP-1 drug usage, duration of therapy, and will we really see a reduction ultimately in the prevalence of obesity and thus in the diabetic population? I think that is frankly well beyond the time horizon for an investor at this point because of just, again, how efficacious these therapies, both the diabetes therapies and the obesity drug therapies, are and how early we are in terms of the penetration and evolution curve in those markets.
Right, I feel like we're just starting to scratch the surface here, even though, like you said, these treatments have been around for a long time for diabetes, but now that they're starting to get approved for weight loss, the hopefully positive effects from that, and we're waiting even in November for the American Heart Association's study on cardiovascular health. So it'll be interesting to see what their results are and what it turns out to be as far as people who have cardiac issues, if taking some of these GLP-1s or other drugs makes an impact positively in
there
their
are going
life.
to be a lot of data readouts over the next few years showing what these GLP-1 drugs do and how they impact other health conditions, and that will inform insurers and governments on how widely to cover these drugs, and also that'll impact the duration of therapy. I think there are a lot of unknowns, but it's very clear that these drugs result in substantial weight loss and that there are health benefits as a result of substantial weight loss.
Right. So Nadia, just to kind of bring it back to the investment side, again, on the equity side specifically, which you cover more broadly, there's been a lot of talk out there that these particular treatments change the way food tastes to people. They don't want to eat. They don't like to go out with friends because they're just going to sit there and maybe, look at the food and not be appetized by it. And as we know, our culture was essentially built on community, and community equals eating together. People love going out, even from the days of sitting around a fire, people ate together to communicate and gather. So what does this say about, sort of the social impact and then the investment side of that when it comes to food, when it comes to even apparel, travel? What are your thoughts there?
Absolutely, Anthony. So we did see a knee-jerk reaction in some of the food stocks, restaurant stocks, apparel stocks, and fitness stocks back in August after we saw top-line results on the Novo study. But as we know, consumer behavior takes a time to change. It's also very difficult to predict. So it's difficult to really say, ultimately what the impact will be outside of healthcare for these new class of weight loss drugs. And so we won't necessarily be making investment decisions outside of healthcare based on that. I mean, there are some concerns that what you could see, as you alluded to, that people that are using GLP-1 drugs to lose weight might not eat as much and might not drink as much, and so this could have an adverse effect on restaurants, apparel companies, as well as tobacco and alcohol companies and so forth, as people become more health conscious. You also could see, in terms of, there is an argument that you could see a wardrobe refresh in apparel as those waistlines sort to shrink. There's also this argument out there that people become more fitness fitness conscious, and so maybe they'll start to go to the gym more. But there's also another argument to say that maybe people will go to the gym less because they have less weight now to shed in the gym. So Anthony, again, it's a bit early, and so we would not be shifting portfolio decisions outside of healthcare based on this. It still remains to be seen.
Great. I appreciate you both being very transparent and clear about that. It is very early days, and incrementally, nothing really that's going to be substantially changing the investment landscape, at least not in the near term. So thank you both, Nadia and Eric. I really appreciate you both being here. I mean, talk about a fascinating topic that is just making headlines almost every day. My phone blows up every day with some other conversation about these treatments. So the future, we'll see what it holds for weight loss. Great, thank you both.
Sure.
And for all of you out there, take a look at our website, ubs.com/views. Plus, we had a great program recently with Dr. Jamie Kane from Northwell Health. You can find that at ubs.com/CIO Live. We really delved into the specific healthcare benefits or otherwise when it comes to these GLP-1 treatments. So make sure you're checking that out. Again, ubs.com/CIO Live. Don't forget to also follow us on social media. We're on all the channels, including Instagram. Follow our @UBS Trending channel right there for content you're not going to find anywhere else. And when it comes to your investments, the best person to speak to is your financial advisor. So make sure you're speaking with them. Pick up the phone, send them an email, whatever's easier for you, but make sure you're reaching out to those folks. In the meantime, from New York, I'm Anthony Pastore. Have a great day, everyone, and remember to keep your eyes on what's trending. We'll see you soon.